If you have to drop off early, or if you want to catch the recording of this a little bit later on and refer to it in the future, I will share this recording with you all, with all the people that attended a little bit later on. So I'm going to share my screen straight away. And I'm going to start with a bit of an introduction about who I am, who we are, and the purpose of us doing this today. So my name's Andrew. I am an exercise physiologist. I am from Rebound Health. So Rebound Health is an NDIS registered provider. We are based on the Northern Beaches and the North Shore of Sydney. Our backbone is in exercise physiology and physiotherapy. We also do OT and dietetics, but more in the adult mental health spectrum with OT and dietetics there. In COVID, we had a little bit more time on our hands, and we came up with this idea of the Rebound Academy, which was a way for us as exercise physiologists to provide education and some training to other exercise physiologists in the field around the NDIS, around how to work effectively with participants. Because in our world, in the exercise physiology world, there isn't a great sort of training or resources there. And so us being registered for 5 or 6 years now, we saw it as a great opportunity to be able to help other people work really effectively in this space. So that's where the Rebound Academy came from. Why you're all here. So we're speaking today about exercise physiology and ASD. I'll start with what an EP is, understanding the role that EP plays within ASD, funding categories that we can use, as well as a case study and what to expect when referring to an EP. So, exercise physiology is a fairly new profession in the scheme of things. We went to uni and we studied the role that exercise can play in working with people with specific medical or sort of diagnostic conditions. So you will find exercise physiologists in hospitals working in things like outpatient rehab, cardiac rehab, people that have had hip, knee replacements, that sort of thing, and helping people to recover. You'll find us working in the NDIS space, where we work with quite a range of participants. You'll find us working with veterans in the Department of Veterans Affairs, as well as working under Medicare and work cover as well. So we essentially take exercise as a tool to be able to improve the outcomes and improve the quality of life of a whole range of people. The difference between us and what a personal trainer does, PTs will generally work with more your healthy populations, where we work with people that have got or that require, a little bit more care and a little bit more nuance in specific context to a medical condition that they might have. So that's the quick 30-second spiel about exercise physiology. Exercise physiology is covered under the NDIS, and I'll speak a little bit more into the goals that we sort of generally work with our participants with a little bit later on. But for a bit of a 30,000-foot view on ASD and the NDIS landscape, I'm probably preaching to the choir here, but 31%, so this is 2021 data, coming from the Amaze paper, where 31% of NDIS participants have a primary autism diagnosis, and additional 5% of participants have autism as a secondary disability. Now, we noticed those numbers significantly increase when it comes to younger populations. And so you might have read, particularly in the lead up to the federal election a few months ago, that one of the challenges that the NDIS is going to face in the future is this huge increase in the number of participants that will be eligible for the NDIS particularly in this younger age group. Now, in the context of exercise physiology, what we see is that the funding that participants, and I admit that this is not just an exercise physiology thing, this is probably very generally across the board, but there are differences, significant differences with the amount and the type of funding that participants get for exercise physiology. So we know the benefits. We know that exercise can have a significant impact in the lives of people with ASD. But the challenges exist in the framework itself as to how people can get access to exercise physiology, and so that can be delivered in a fun, safe, and effective way. Now, just bear with me for these next couple of slides. They are a little bit word heavy, but I'll try and get through them as quick as I can. I mentioned before that there are research-backed benefits to the role that exercise plays. So this isn't just my opinion, this comes from research. There can be up to 37% improvement in symptoms of ASD, specifically in behavioral and academic improvement. There was a 2018 study that was done, which was 2 sessions of exercise for 48 weeks. And the benefits were particularly pronounced in reductions in stereotypical behavior patterns and improvements in verbal and non-verbal social communication skills. That same study also reported that parent perceptions of their child's quality of life increased significantly in comparison to the control group. So exercise interventions can vary depending on the severity of ASD. And what that means is that depending on how participants or how people with an ASD diagnosis present to us, depends on the type of exercise that we will do with them. What that study showed was that moderate to vigorous exercise can show an effect on decreasing repetitive behavior for children and adolescents with ASD. Exercise is a desirable treatment to reduce self-stimulatory behavior and is an inexpensive and can be an easy form of treatment. Exercise can be described as an antecedent approach, which can assist in preventing detrimental behaviors occurring. I'll give you an example here. We work with a school which has quite a decent sized population of children with an ASD diagnosis. The way that we work with them is that we sort of taught their teachers how to use exercise at the beginning of the day and during the middle of the day in order to help keep those children a little bit more focused when they come into the classrooms and behave in more social settings. So when applied sort of strategically, it can be used to help improve focus and help reduce those detrimental behaviors. That doesn't, in that specific instance, it doesn't mean, hours and hours of exercise. That's 10 to 15 minutes of quite high intensity exercise done safely that can help improve focus for a short period of time. Now, this study also showed that beneficial effects beyond the exercise session itself can also occur. So, people don't just improve their focus while they're exercising, but also in the few hours after they finish exercising. So people then want to know, what sort of exercise should we be doing? It's a bit of a mix. We should be doing both cardiovascular and resistance training. With resistance training, that generally means sort of lifting weights or getting, exerting ourselves. But it doesn't need to be all in one big chunk. It can be broken up across the day. And particularly when we're working with, younger children and adolescents, we want to make it fun and enjoyable. Because if we just tell people to do lots of squats, they're going to get pretty bored pretty quickly. So we need to make it fun and engaging for them. We also know that swimming and water play can work very well when there are larger sensory needs for some children. And we want to focus on sort of building and encouraging fundamental movement skills. So running and catching and kicking and jumping and those sort of things. Activities and movements that will translate not just when they're in the gym or not just when they're doing exercise, but into everything that they do in daily life. They're the key movements that we want to be focusing on. So we, as Rebound Health, we work with quite a number of people with a diagnosis of ASD. When people come to us, these are the goals, or these are the NDIS goals that we generally see as the rationale for them to be referred to us. So finding and keeping a job. So that can be improvements in strength and endurance so that they can maintain or improve their functional measures to be able to keep up with the demands of their job. Building relationships and social interaction. I mentioned before around the importance of keeping it fun, keeping it sort of engaging for young people, and doing that. Well, one of the ways that we do that is in small groups, so that 3 or 4 participants can come together. They can build some social relationships, and they can do it in an environment that is safe and sort of conducive to forming those relationships. And then sort of the most obvious one would be improving health and well-being. So whether that is managing side effects of medication, developing healthy routines around exercise, because not only would exercise help with the benefits or the side effects of ASD in particular, but just in terms of general health, exercise does play a pretty significant role in reducing the risk of cardiovascular disease and diabetes and sort of many other things. So that healthy routine that we can help instill and develop in young people can go a long way to setting them up successfully for their life. And then also fine and gross motor skill development. Again, when we're playing games and when we're making the exercise interactive with people, we want to also have the opportunity to help improve their coordination and their balance, so that, again, the skills that they are learning can be translated outside of the gym into everything that they do in daily life. So in specific regard to ASD, I'll go into a little bit more detail, but these are the sort of goals that we have as clinicians when we're working with people with ASD. Things like I mentioned before, developing and practicing gross motor skills, practicing communication skills and social skills in a small group of other participants or other kids, learning to follow instructions that's from somebody outside of their family or outside of their therapy group, and developing new interests. What I suppose some of the feedback that we've had from parents of children that we work with is that it can be sometimes challenging for them to find groups or opportunities for their child to exercise, because depending on the way that their diagnosis presents, they might not be suitable for more mainstream exercise or sporting groups. So they don't get that opportunity to socialize and learn how to follow instructions from other people. And so that's where we sort of help and We tailor our programs to the needs of the child, needs of the young person, so that they can develop these skills in a more controlled environment. Some of the barriers that we see in this population is some coordination challenges and some balance challenges. So this is obviously becomes a very important part of our program. There can be in some young people some anxiety or depression about being in a social environment, about being with other people, and about being in an environment they're unfamiliar with. And so when we start working with these people, we understand that this might be a challenge, and so we want to increase their exposure gradually and at a pace that they feel is sort of safe and durable for them. In some cases, there can be an ADHD component or sub-diagnosis here. And some of the challenges there are around difficulty staying focused, difficulty staying on task or follow instructions. So again, this is where patience needs to come in and just repeating messages in a way that is going to resonate with that young person. What can help? So they're the barriers, but what can actually help make these interventions more effective is finding interests that these young people have to be able to build rapport with them. We find that that's very important. The relationship that the exercise physiologist or the therapist has with the young person can go a long way to making that person engage better, have fun, and engage with the other people in that environment, is when rapport has been built. Finding out what equipment that they like using or what exercises they like doing, and focusing more on them, and sort of putting to the side exercises that they're not enjoying. We will often use a whiteboard to just lay out what the program session will look like for that young person, so that they can get in their minds a bit of a process about what is going to come up, and that can help manage some of the uncertainty that they might be feeling. As well as, you'll see in our gym that a lot of our therapists will get involved in the exercise and the movements that the participants are doing, because it might be it's easier to become less distracted if somebody is doing that exercise sort of side by side with you. So often getting in and doing it with the participants can be a big help there. I'm going to present a case study. It's obviously de-identified here, but this is a young person that has been coming into our clinic for a couple of years now. And it's more of an understanding about how, like, I've just given you sort of the research and the rationale behind it, but practically this is how we sort of adapt this across to a young person. So the participant context, this was a 9-year-old. This person's NDIS goals were to increase his physical capacity and strengthen to be able to get through a full day of school without fatiguing, to improve his social skills and engagement, so he can be a fully functioning, engaged, valued member of society, improve communication skills so that I can better relate to my peers, and be able to regulate my emotions and sensory needs, to feel comfortable in my surroundings and behave in a positive and constructive manner. So they were his goals. What we worked on, we worked to establish a routine and a healthy relationship with exercise. Now, this young person's dad actually joined in the sessions with him, and that helped him to, as a bit of a family unit, to develop that healthy relationship with exercise. For this 9-year-old, we sort of recommended exercises focusing on improving coordination and motor patterns, so that he could help, or so that we could help him to build his capacity and perform his activities of daily living independently. We wanted to introduce new physical and cognitive tasks to improve his learning ability and his communicative skills. And so basically what that meant is that we made exercises progressively harder for him, and that might include both a physical and a cognitive component to it. So he was using his brain in different ways. Exercises focusing on building muscle strength and physical capacity so as to reduce fatigue and improve the ability to participate in full days of activity, which for this young person was about school. How we did it. So with this person's context, he was coming in once a week with one of our team doing a one-on-one session. And then we had him in a small group as well. He actually transitioned from one-to-one into small group sessions. And we incorporated his dad in these sessions as well to help, him manage some of the anxiety that he was feeling, but also to help keep him focused and make it fun because he was doing it with his dad. So that's a bit of a case study. So we continue to work with this young person, and we are now just he's gotten into a nice healthy routine with exercise, and we're now sort of understanding where he wants to go in terms of in the future participating in sort of social and recreational sport. So we're helping him. Our goal with him will be to help him transition to be able to go and play soccer with some of the kids in his school. As an exercise physiologist, there's two ways that we access funding within the NDIS. One is through improved health and wellbeing. The other one is improved daily living. As of October last year, those are the rates for one-to-one sessions. In groups, we basically take that hourly rate and we divide it by how many participants are in that class. We generally have our classes at 3 to 4 participants at a time. We find that's a good number to be able to sort of give everyone individual attention, for them to be in a group and not to feel overwhelmed in that social scenario. I mentioned just groups there, but in addition to those groups, we can do telehealth. We did a lot of telehealth through COVID. Gratefully, that is reducing now, and we obviously do work in our clinics, but also in the community, depending on the needs of the family and of the young person. We can travel to them. So as support coordinators, when you refer to an exercise physiologist, there's a few things that you should expect from us. Clear communication. You should get regular updates about how the participant is progressing, what challenges might be, or what are some of the barriers to achieving or working towards goals, and what are our strategies to overcome those things. A discussion about the best way to use funding, because like I've just presented, there are different ways that we can use funding that takes into account the needs and the goals of the participant. Good reports, that's sort of fundamental now in the NDIS. Targeting criteria and not just templated reports. We should obviously be on top of when plan reviews are coming up, and be able to deliver those reports in a timely way, so that people are prepared adequately for those plan reviews. And also knowledge of the NDIS, and particularly in this context, understanding that in our context, the benefit of exercise might not just be let's get stronger and fitter, but it might be around building relationships, improving social circles, and gaining more confidence in themselves to be able to lead the life that they want to lead. So an understanding of the NDIS as a scheme, and not just the prescription of exercise to go and do independently. That is it. It is 12:27, so I've done very well to keep this under half an hour. That was a very, very brief overview of exercise and ASD. If you would like any more information, please reach out. You can find our details on reboundhealth.com.au. And my email address is andrew@reboundhealth.com.au. If you have any questions, or if you would like any further clarification, please reach out to me. I am more than happy to have a chat and see and answer some of those questions.
Andrew, before was the training half an hour, or was it
half an
1
hour?
hour? Oh, was it? Oh, okay. I'm just going to ask you a question quickly. We've got 2 minutes. You've talked about ASD and in younger people. What's your experience working with older people? Because most of our participants in our organization are 18 and above. Mm-hmm. Have you worked with many 18 and above, and is there a good outcome, or is it longer or harder because they're much older?
Well, that's a really good question. When people are growing, the changes that you can sort of see tend to be a little bit faster. Mm-hmm. We do. So we only work with, we're not an ECIC provider, so we work mm-hmm. with children sort of 7, 8 years and above. We don't work with very young mm-hmm. kids. It can take longer, I suppose, is mm-hmm. the shorter answer to your question. Yes, we do work with youth and adults. Mm-hmm. The changes or the benefits that I mentioned previously, you can still see. They mm-hmm. might just take a little bit longer.
Okay. So if I've got a participant now and I'm going for a plan review and I want to request that they have this funding, how many hours, because obviously you haven't met them, but I've met you, I know about your company. How do I know how many hours to request to have in their plan? Like what would be your recommendation with that?
So we've worked in this space for a little while, and the challenge that you just sort of highlighted there was that not a lot of people understand like how exercise physiology works. So what we do is, if you would like to advocate for exercise physiology for a participant of yours, mm-hmm. we can do an assessment and report complimentary
okay.
free, to advocate for that. Whether or not they want to use or you want to use our services in the future, we don't mind. Okay. We just do this as a service to create more awareness about exercise physiology. Okay. So what we would recommend would be based on our assessment.
Okay, cool. And then do you only work with ASD, or do you work with other disabilities? Because I feel that your program would work well with other disabilities as well.
So we work with intellectual disability. We work with Special Olympics in our local area. We are a private clinic, so there are some areas that we know great providers in our local area that we would refer out to if it doesn't fit within our scope. Okay. We don't work with pediatrics. We work with sort of younger people and above. Yeah. And particularly in that, in that sort of area. But yeah.
Wonderful. Thank you. Going over by 1 minute.
Absolute pleasure. Absolute pleasure. Like I said.
Hey, Andrew.
Yo, shoot.
Hey, I'm going to put my I'll put my video on so you can see me. It's Wendy here.
Hello, Wendy. How are you?
Good. How are you?
Very well, thank you.
That's good. I just wanted to ask you something and see if you're seeing any changes in this, because as you said, exercise physiology is relatively new, and like everything with the NDIS, we really are having to prove eligibility and justification. A lot of people, as you probably know, that that I work with, and it's probably a similar thing, we're having to, I mean, exercise physiology and exercise is so important, but we're having to more access that through core funding and getting it through under the social, you know, and community participation access kind of small group thing. Are you seeing any more patterns, positive patterns of that people are getting the funding now in improved wellbeing and you know, capacity building?
Yeah, like really good question, Wendy. We definitely noticed over the last 2 years, like since COVID came around, that was very much the case, that it was being pushed into more that core support. I think a couple of, before I say that, we still are able to advocate quite well for our participants. And I think that goes to the strength of the reports that we write. So
definitely, it's so important. Like you wouldn't think it should be, like just getting it right in how the NDIS wants it.
And the challenge there, and like I said at the top, you know, this was actually part of the reason why we started this Rebound Academy sort of subgroup, is that exercise physiologists didn't know how to advocate properly for funding, because we were writing reports the same way that we would write a report for Medicare or for workers' compensation. We were focused very much on outcomes as opposed to focused on goals. Sort of that, you know, the tenets of the NDIS. So despite this sort of general push towards core, we've found that our participants have been able to, you know, retain the funding that they have, which I think is largely part due to the reports and the effort that we sort of put into those.
Yeah,
it's hard though.
It is, yeah. It is. It's really hard, but I think, yeah, that's half the barrier, is actually getting the reports right and being strong. And even with all that data that you provided at the beginning, like a lot of that is going to be really helpful and provide the evidence that, you know, this is really important, that it's funded. Yeah,
look, just between you and me and whoever you tell, we are, like, our governing body is now going through a process that we are a part of feasibility and acceptability studies, understanding in the context of the NDIS. So being able to provide planners with some sort of up-to-date real life impact of exercise as an intervention for someone, so that the funding that people get is more standardized. Sorry, that's a bad word. Is more even across the board, as opposed to these big disparities in.
Yes. Yeah.
So that's coming over the next few years, where you know, we will be able to advocate based more off like research and how it actually impacts participants in the real world, rather than relying on, you know, scientific studies that lack some of that NDIS context. Yeah. Very good question, though.
And you're only in New South Wales. I just realized you're not in Victoria. We're from Victoria. You're not in Victoria, are you?
No, but I've got some great colleagues. So if you want a recommendation, you just
I'll shoot you an email. Thank you.
I know some great people in Victoria.
Excellent. All right. Well, have a good one. Thank you so much.
Absolute pleasure. Thank you so much for joining, team. All the best.
Bye-bye.
Have a super day.
Thanks. Bye.